Today's lecture will cover infection control. Microbes are microscopic organisms that can cause infections and disease. A disease is a deviation or interruption in the normal structure or function of any organ, part, system that is characterized by signs and symptoms with a known or unknown cause. Bacteria are microscopic single-celled prokaryotic, which means they have no nucleus or cell membrane, and they are unable to ingest particulates or liquid droplets. They may reside in a host as a colony. They are identified by morphology, which means size and shape, biochemistry, and genetics. There are three primary morphologies: cocci or spheres, bacilli or rods, and spirals. They may form resistance to the external environment. Viruses are simpler than bacteria. They are not prokaryotic or eukaryotic. They have a nucleus. They cannot live outside a living cell. They are characterized by a chemical nature of nucleic acid, size, and symmetry. A virin is a viral particle that attaches itself to a host cell and then inserts genetic information. It can be latent or dormant. Fungi can be micro or macroscopic, intracellular organelles which are visualized within fungal cell. Dimorphic means that they have the ability to grow two distinct forms. Diseases have four classifications: superficial, cutaneous, which means it involves the hair, skin, and nails; subcutaneous means it was from an opening in the skin; and systemic, which means either circulatory or lymphatic. Protozoan parasites are unicellular, not plants or animals. They have no cell wall, and they are greater size than bacteria. They are eukaryotic and motile, which means they are constantly moving. They are characterized by their motility. Amoeboid locomotion is slow-flowing. Flagellum has a tail. Cilia have many small hairs or legs, and sporozoans are non-motile and they do not form spores. There are 6 steps to the establishment of disease: the encounter, which means coming in contact with the host directly or indirectly; the entry is when they adhere to the surface of a cell and excrete the toxins; penetration beyond the epithelial barrier; spread is determined by the site and anatomy; multiplication is the incubation period; damage is either direct or indirect. Direct is cell death by destruction or toxins; indirect is altering the metabolism of the host or induction of the host response; and then the outcome, which is when the host gains control and eliminates the agent. The infectious agent overcomes the host's immunities to cause disease, and the host and infectious agent compromise and live together. There are 4 components to the chain of infection: the host, the infectious microorganism, the mode of transmission, and the reservoir. A contagion is the agent that's spreading the disease, and contagious is when the contagions are present. All 4 factors must be present or the infections are not transmitted and the chain is broken and the infection ceases. The hosts are typically humans. They are abundant amount of organic nutrients and metabolites. Each region of the body has a different pH, fluid level, and temperature. So the infectious microorganisms can be either bacteria, virus, fungi, or protozoa. Mode of transmission is how they move around into the body. Exogenously is from outside of the body. Endogenously is from inside of the body. Direct contact involves touching of some sort. And indirect contact, a vector is an arthropod that's used for entry, such as a flea, mosquito, or tick. And a fomite is an inanimate object, such as a doorknob, equipment, or food. The reservoir is the site where the infectious agent can remain alive and transmit, and it can be people, animals, or inanimate objects. A carrier is the person who serves as the reservoir. Healthcare-associated infections, also known as HAI, are infections that are acquired during treatment in a healthcare setting. Nosocomial are hospital-acquired. Iatrogenic results from intervention of a physician. And hospital patients have increased sensitivity to infection due to being immunocompromised. Some sources, medical personnel, direct or indirect ingestion or inhalation. Patient flora, they have a compromised immune system that causes flora to flourish. Contaminated healthcare environment, which means fomites. Bloodborne pathogens, which means the disease-causing pathogens are present in the blood, such as with HIV and hepatitis B, and invasive procedures, either diagnostic or therapeutic. For microbial control within the host, we have a basic human defense. The mechanical defense is the intact skin. A chemical defense is the mucous membranes. And a cellular defense is phagocytic cells that destroy pathogens. Normal microbial flora are good bacteria. Chemotherapy has selective toxicity, and immunizations or vaccines are a mixture to induce immunity. For environmental control, asepsis. So medical asepsis is the reduction in the number of infection agents. Surgical asepsis is the complete removal of the infectious agents. This is accomplished by either chemicals or disinfectants, or sterilization with heat or gas. Always perform hand washing before, during, and after patient care, and use standard precautions, which this involves body fluid precautions and body substance isolation, and using hand washing, gloves, personal protective equipment, and transmission-based policies and procedures. Transmission-based precautions. Airborne, negative pressure rooms, masks, organisms remain suspended in air for long periods of time, such as if patients have TB, measles, or varicella. Droplet, patients are in private rooms. This involves particulate droplets that are expelled through coughing, sneezing, talking, and this includes the flu, mumps, and the adenovirus. And then contact, direct or indirect. It's important to use your PPEs, and this involves staph, hepatitis A, impetigo, and varicella.